Hello, my name's Dr. Kurt Verhelst, and I want to talk to you about debunking chiropractic and infants and babies and toddlers. So there's plenty of research out there that talks about the benefits of chiropractic care for infants and babies. And I'll tell you some of my own experiences. I've taken care of thousands of babies over my 38 years of practice. Probably the first most important thing is when a baby is born naturally, 8 out of 10 have some sort of problem with the upper cervical spine. It's even worse with C-section because they grab and pull more. So that's a number one area that we always want to check right away. But however, one of the things that people talk about is infant colic. That's kind of an older term. Now they call it acid reflux and stuff like that. Well, infant colic is all kinds of digestive issues, maybe constipation, and I really believe it's a chiropractic problem because you can turn kids around almost immediately. One or two adjustments and it turns them around. See, they haven't been around long enough to anything set in. And so that's been a big, huge situation that we've taken care of. And it enhances feeding, especially breastfeeding, because sometimes things are off and they can't breastfeed off of one breast or the other, and we can correct that immediately. Also, when kids are under the weather and have a fever, and this is for even human adults and teenagers and everything, that when you get an adjustment when you're feeling ill, like say low grade temp, a lot of times when you maximize the nervous system's function, the body turns around, and a lot of times fever spikes, and the next day the fever's gone. And so this is something that's amazing, blows young moms away when we get their kids over and they don't have to take them to the doctor and get prescribed like antibiotics or whatever like that. And obviously adjustments enhances sleep, and who wants to make sure the baby's not uncomfortable so they can sleep? You know, a lot of young moms and dads that are not getting to sleep because their baby's not sleeping. So I just wanted to debunk that kind of stuff. Some people just think it's awful that you adjust little babies, but their spines are completely, hugely resilient. The adjustment is very accurate and precise and light. And it startles them a little bit sometimes, but they get over it quickly. So this is my short, and I'll catch you next time.